First, I would like to ask for your permission to use this video for educational purpose.
Yes.
Thank you. Now tell me about what your symptoms were before the surgery.
Just totally miserable. My back would lock up,
Mm-hmm.
and you just had to wait for it to let loose because you couldn't do nothing.
You had pain. 1 to 10, how bad was the pain?
It was a 10 or worse.
How long?
Probably the last. Yeah, I've had it for 18 years.
But it was getting really worse toward the end, right?
Yeah.
How was walking?
Horrible.
Okay.
Well, I couldn't do near the things I should be doing.
Okay. The surgery wasn't long ago. It was just 4 weeks ago.
Yeah.
You stayed in the hospital how long?
2 days.
Okay. So you had the AFib. You had it before. And actually, one day after the surgery, I was ready to let you go home. But the hospitalists want to keep you and control your heart maybe one more night. But within 2 days, you did go home.
Yeah.
How long after the day of the surgery? Did you walk the day of the surgery or was it next day? Okay.
Yeah.
And how are you now? How is the pain?
Right now, I don't really have any pain back there.
So that pain that you had before the surgery more or less is gone?
It's gone.
Okay. You said you put a percentage of how much you have improved just 4 weeks after the surgery. What percentage would you put on that?
90-some%.
90-some%, excellent. Well, and we did we did a 3-level OLLIF procedure. These are the screws, they are in a good position. And we took care of the bad disc and took them out and put a spacer in. And that actually opened up the space, and even the leg pain, so I understand, is mostly gone. Is that correct?
Yes.
No, I usually don't do that, but you told me a personal story about your neighbor, and not to put other surgeries down, but there are very few people doing the surgery OLLIF this way. Tell me about your neighbor a little.
Well, she had back problems. They went in, and actually what they did, they opened her up.
They did an open surgery.
Yeah, open surgery.
And she went through a spinal fusion like you did.
Yes.
How is she?
Well, they told her she probably will never walk again.
Okay. Now, sometimes complications usually happen, but what we noticed that those kind of outcomes are not, they are more often after open surgery, whereas our surgery more look like the way you are describing it.
Yeah.
The open surgery is much more demanding. Do you know how long she stayed in the hospital and all the things? Do you know?
In the hospital just about 2 weeks.
2 weeks, okay.
And then after she got out, she had to lay flat on her back for a week in bed.
Yeah. And
it hasn't been that long that they actually got her up in a wheelchair, but she cannot stand or do anything.
Okay.
And then
the outcome you're seeing with you is what we see every day, and the outcome you see with the other surgery as well as the daily occurrence is nothing unusual. But overall, happy with this result so far?
Amazing. For the last 10 years, the bottom of his right foot, he has not had no feeling in it, no.
Okay.
And that has completely come back.
Excellent.
And the strength in that.
We still have another year to go for the complete bone healing, but I think we are on track.
I think so.
Well, thank you so much for the interview.
Thank you.